What is fenestration in regard to orthodontic treatment? Effectively, it is the same as dehiscence. This is when a tooth, rather than being moved through the bone and the root staying completely within the bone, this is when a tooth is moved out of the bone. Sometimes it can just be the tips of the root, sometimes it can be a whole side of the root. And interestingly, this is becoming a bigger and bigger problem within orthodontics. Recently, talking to a forensic dentist, he has noticed fenestrations in a large number of the cases that he's been asked to examine. This is something he never saw previously, and it may be related to the rise of non-extraction therapies where people expand the upper and lower dental arches. When these therapies occur, the bone moves with the teeth. For if you move a group of teeth, the bone tends to move with that tooth, rather than an individual tooth where the bone doesn't tend to move with that tooth. Now, as the teeth are expanded out, you can gain a very nice non-extraction result. But there's a reason the teeth and the bone are in any one position, because they sit in a balance between the tongue and the cheeks or lips, with some effect from the bite force. Now, simply moving the teeth out doesn't change this balance. The bone will temporarily go with the teeth, but the teeth are then held with permanent retainers, and after a while the zones of balance will restore themselves and the bone will return to being in the position of that zone of balance. If the teeth are held out in an expanded position that is wider than this, then the bone will move back, leaving the teeth fenestrated outside the bone. And I worry that in the future we may have more periodontal problems due to this.